So my name is Dr. Paul Despres, and I am a co-owner and physician at Aspen Integrative Medical Center in Flagstaff, Arizona. As a naturopathic physician, I'm very focused on toxins, environmental medicine, and hence my excitement for this presentation and to share it with you today. So the title of this presentation is, Are You Toxic? How to Detox and Live a Healthy Life. So just a quick disclaimer, this is more informational only. Please don't use this information to diagnose, self-treat. However, I do want this information to be useful to you. So there's stuff that you can use, but just use it with your own discretion. And if you have any side effects or issues, it really is important to consult with a healthcare provider if you're going to do any sort of detox, especially if you have a high degree of toxicity in your past, but also if you have a history of chronic disease, because usually folks with chronic illness have a higher degree of toxicity as well, and they need to be careful. So brief personal bio about myself. I'm passionate about providing a superior patient care experience, and that superior experience, I believe, is built on good relationships and good rapport and trust with my patients, knowing that I will research and work very hard and provide very detailed plans. I will give patients a lot of time and be very responsive with questions and phone calls and so forth. But the overall goal is to help everyone achieve the greatest health possible, using the most natural therapies as possible as well. But I do use pharmaceuticals a lot. It just kind of depends on the degree of illness you have and that patient's preference for what type of treatments they're looking for. So I've been practicing for about 6.5 years. I specialize in gastrointestinal health, thyroid disorders, autoimmune disease, infectious disease, men's health, long COVID, and environmental medicine. Here's a picture of myself and my wife, Dr. Amelie. We got married at the Flagstaff courthouse a couple of weeks ago. We wanted to do it in Flagstaff because we're going to make Flagstaff our home. We're going to be working together starting in the fall, and we really want to integrate well with the Flagstaff community and really help this community as a whole have more health care resources. Here's a little bit about our clinic and some of the services we offer. We're a full service medical clinic, so primary general care. We also do home visits and urgent care and focus a lot on IV therapy, hyperbaric, and we just added a infrared sauna. So there aren't really a lot of infrared saunas that I know of in the Flagstaff, Northern Arizona area, so we're really excited to have this. We're offering a special, if anyone's interested, if you buy one sauna session, you get one free. So that means you could get 2 for yourself, or you could share one with a loved one or a friend. And then if you did buy any sort of package, there's the thing down there for 10 sessions or a monthly pass. So today's webinar, we're going to focus on why detoxification is important. What are the main sources of toxins? The phases of detox in the liver, the major organs of elimination, symptoms and conditions that suggest you may have a high toxin load, how to determine your degree of toxicity, why detox should be a priority for everyone, maybe some signs that show you aren't necessarily ready to start a detox protocol, and then I present an 8-week detox protocol that I use very frequently. So detox is important now more than ever due to the number and quantity of toxins we're exposed to on a day-to-day basis. I can speak very personally and professionally that toxins are a contributor to almost every illness. They can make things much worse. They can disturb your immune system. They can disturb your hormones, cause chronic pain, fatigue, and so forth. We'll get to that. One of the most alarming things, or most alarming toxins these days, is glyphosate, which is found in Roundup. It is a water-soluble toxin. So just kind of let that sit in there and imagine how much of the world is water. So glyphosate is coming down in rainfall. It's getting in our water systems. It's in our drinking waters. And glyphosate is a strong endocrine hormone disruptor. It really disturbs the gut, causes leaky gut. But then there's also the issues with chemicals just not being regulated, and also the number of chemicals that we're being exposed to on a day-to-day basis. And I could go on, but I'm going to keep going. So the main sources of exogenous toxins, and when I say exogenous, I mean toxins that are coming into our bodies from the outside world. So I'm not really going to be talking a whole lot about internal, like metabolic toxins we create just from normal bodily processes. But we're going to focus more on the ones that we're being exposed to in our environment. So the main ones come from our food, sprayed on through pesticides, herbicides like glyphosate. We're being exposed to a lot of toxins through our personal healthcare products, our shampoos, our lotions, and things like that. Home building materials, mattresses, furniture, black mold, paints. So for example, if you get a new mattress, if you get a nice Casper cushion mattress, you might want to keep it outside until it's done off-gassing before you actually bring it into your home. If you're ever having a very strong smell or reaction to a strong smell from a new product, like a new car, you really need to let that air out. That's your body telling you it's too much for your system. Also, cleaning materials, detergents, fragrances, of course, commercial, industrial pollutions, seafood like tuna is high in mercury, our water supply, and then medical interventions like pharmaceuticals, radiation exposure, imaging contrast dyes, and breast implants. The three main detox phases of the liver consists of activation, mobilization, and then transport of toxins. So the body is really smart. It'll take something that is foreign, like a toxin, and it will modify it in a way that it can be processed through the liver and through the kidneys and then get out through the body, whether through the urine or through the stool. The main organs of elimination, which I kind of hinted at there, are the kidneys, the gastrointestinal tract, the skin, and lungs. So you're getting rid of toxins through the urine, stool, sweat, and breath. And then there's some suggestions here how to stimulate all those different emunctories. But the ones that are often forgotten are the circulatory system. We really need to increase our heart rate, increase circulation, so toxins can get to the liver and kidney in the first place. And also through the lymphatic channels. So this is the major highway of the immune system. So there's going to be a lot of detox happening there for different debris and things that are broken down through the immune system. And then probably the most forgotten emunctory, in my opinion, is actually the nervous system. So the nervous system also needs to have some discharge detox as well. You can have memories, you can have trauma, things that stay lodged in the body. The best example of this is if you actually think of maybe a moment in time in your life where it was traumatic or was a very happy moment, like a holiday. If you just think about it, you can kind of feel what it feels in your body. Those same emotions come up. Sometimes you have shaking, you might have tears if it's more of a negative emotion or memory. And we really need to discharge those memories and emotions as well, because they can stay lodged in the body and disrupt all the other emunctories. So some symptoms and conditions associated with a high toxin load. It's helpful to bring up that some people are just high bioaccumulators of toxins. Sometimes this happens because they have a high infection load. They might have genetic or congenital reasons that they hold on to toxins. They might have high inflammation levels, autoimmunity, elevated sympathetic tone, trauma, and so forth. So some of the symptoms include fatigue, brain fog, difficulty concentrating, difficulty sweating is a major alarm, allergies, headaches, asthma, highly reactive to smells, medication, supplements, and food, certain gastrointestinal symptoms like diarrhea, constipation, also rashes, balance problems, joint pains, abnormal sex hormones. So some of the conditions I very commonly see as a physician are autoimmune disease, hypothyroidism, gastrointestinal disorders, neurodegenerative disease like Alzheimer's is very heavily associated with aluminum, mast cell activation, recurrent infections, migraines, diabetes, infertility, and some mood disorders like depression and anxiety. So here is a environmental exposure screening questionnaire that I really like. This is actually by Dr. Walter Krinian. And this is just a little screenshot of the first page, but I'm providing you a link. So if you want to go to that link and fill out the questionnaire, that'll give you a sense of your degree of toxicity, but also might highlight or bring attention to some areas in your life where you are being frequently exposed to toxins, because the first step in detox is reducing exposure. So whatever I can do to increase your awareness of where toxins are coming into your body or being exposed is going to be the best step for detox for you. As far as testing, so if we wanted to look at blood, urine, or hair, blood work, there's some basic blood work that can be helpful that we usually do anyways because of insurance covering it. But in general, standard blood work is only going to find if you're having a very acute or severe exposure, like to lead, mercury, cadmium, and so forth. There are some indirect markers that show that toxins might be affecting your hormones and things in a certain way. But in general, blood work doesn't really provide a detail on the degree or type of toxins you have. As far as getting a better sense of your heavy metal burden, that's where I really like urine testing, and we do a pre and post chelation challenge with EDTA and DMPS to get a sense of what your total heavy metal burden is. The reason you need to chelate, the body is actually very smart that it won't actively circulate toxins in the blood. It will stash them away into tissues, joint spaces, bones, and things like that. And we really don't know what that total burden is unless we chelate, unless we pull those metals out. So the best way to do the chelation therapy is through IV therapy. Some of the other urine tests include like Great Plains for glyphosate, also mycotoxin testing. Some people use hair for toxin testing. I just don't find it to be as accurate. So my preference is more for urine, and then that complements the blood work that we might do. So yes, it is helpful to determine a person's degree and type of toxicity that they have, because then we can fine-tune treatment recommendations. But I will highlight that detox is important for everyone, regardless of your level of toxicity, regardless as what type of toxins you have. Detox really should be a focus point of everybody's daily life. Some of the reasons that you may not want to start pushing your detox pathways, that you may want to consult with a provider to get better guidance, is you suffer from constipation, you have a very difficulty sweating, you have multiple chemical sensitivity, you have a chronic illness like chronic kidney disease. We really don't want more toxins going through the kidney if your filtration rate is already impaired. Heart condition, autoimmune disease, chronic infections, and impaired bile production. So bile is another way that your liver gets rid of toxins. So if any of these apply to you, you really should consult a physician who is knowledgeable about detox, just so you get more personal guidance, because we do not want you to detox and then those toxins to cause more tissue damage or harm to your body. So I came up with an 8-week detoxification protocol. It kind of goes along the lines of reducing exposure, starting supplements, supporting your gastrointestinal tract detox, liver detox, kidney detox, and then maintaining. The foundations of detox. So I am going to provide you with a very detailed suggestion of how you could detox at home. But these are the overarching principles that you need to know, and the things that really, if you want to keep it simple, this is what you really should just focus on. We need to reduce toxin exposure, eat a very clean diet, drink lots of water, have binders, whether it's supplemental or food binders, make sure you're having regular bowel movements, you're sweating daily, movement exercise to help move toxins through the body, relaxation to calm your nervous system, and then adding any additional supplements as needed to support where you need additional support. I've also created a detoxification package that we offer at Aspen. This is a complementary thing to the 8-week protocol. It basically consists of IV therapy, sauna, glutathione injections, and massage to facilitate an even deeper level of detox. So if you're really looking to hit this hard, I would really suggest this, because these can help you achieve a better detox in a quicker manner. All right, so week one, well, this is the most important stage in detox, because if you can't reduce the amount of toxins coming in, it's kind of futile to go through a detox in the first place. So here are some of my suggestions for trying to reduce your exposure to toxins. I won't read everything. I'll let you kind of read through it later when I share the PowerPoint with you. But clean water intake, movement and exercise, the sweating, avoiding toxins in a workplace and home. So clean air, opening windows, using HEPA filters in home. Some kitchen suggestions like avoiding aluminum or non-stick pans, certain non-toxic detergents, soaps, and chemicals. Limit your plastic use. So BPA is a huge issue. Choosing glass, stainless steel, and wood over plastics when possible. We've talked about avoiding off-gassing, mold prevention, avoiding personal body and beauty products that could be disrupting you, limiting EMF exposure, avoiding alcohol, caffeine, and recreational substances. And then also what's really important is some daily meditation or mindfulness practice to calm your nervous system down. As far as what type of diet I would suggest, here is an overview of a clean organic diet. In general, organic, real unprocessed food is the most helpful. You know, eating a half pound of brassica, which is high in sulforaphane, helps support detox pathways. Eating a lot of vegetables from the clean 15 and avoiding the dirty dozen. Using some oils, but not in excess. And focusing on grass-fed meats, pasture-raised chicken, small wild-caught fish, and eggs as your protein source. As far as diet don'ts, you know, processed refined foods, you know, your fatty fried foods, conventional produce, and so forth. So one of my mentors, or another provider I really look up to, is Dr. Paul Anderson in our field. He has this cool juice recipe that I want to share with you. It's a way to combine beetroot, the beet tops, carrots, berries, which high in antioxidants, kale or dark greens, and a way of making it's kind of like a juice smoothie. This could be really helpful for supporting your liver and also your kidneys. So this would be a good supplement to do in addition to the diet and everything else. Here's a guide on how to avoid mercury in fish. So kind of a guide of which fish are high and low in mercury. You really should only be eating fish a few times a week at most, maybe a few times, 3 to 4 times a month. Shopper's Guide to Produce, so a list of the dirty dozen and clean 15 as a reference for you. Now, if you really, depending on where you live, if it's hard to eat a fully organic diet, I would really suggest just focusing on these, avoiding the dirty dozen and eating more of the clean 15 if you can. I know we all just have different degree of access to organic produce, so hopefully you find this helpful. All right, so week 2, after we've reduced exposure and done diet and lifestyle things, we might start adding in some supplements. So these are the ones that I would recommend. They're kind of basic: magnesium, vitamin C, but what is most important is the binders. So binders are help your body bind the toxins and get out through your stool. So oftentimes we use foods like flaxseed, ground chia, acacia powder, and basically it's a bulking agent. So when your liver and bile secrete toxins out through bile, it bumps into all that fiber and gets out through your stool. You can also do supplements like activated charcoal, bentonite clay, zeolite, silica, and so forth. Those have a little bit more binding affinity to just kind of soak up everything, kind of like a sponge. Those can be really helpful, but the key here is if you're going to do any binder like activated charcoal, you don't want to take it at the same time as medications or supplements, and also don't take it at the same time as food, because we don't want it to bind to those and prevent them from absorbing. So we don't want you to get a nutrient deficiency, and also we don't want to bind to a medication and then you'd have issues related to not having high levels of that medication circulating in your body. As far as weeks 3 and 4, so this is the gastrointestinal detox stage. Here, we're trying to kind of reset your gut microbiome. We're doing this by breaking some biofilms, killing any abnormal or bad bacteria. We're also doing a probiotic and some gut healing herbs, like deglycerized licorice and certain nutrients that help repair the intestinal lining, like glutamine and quercetin. Helpful therapies during the stage could be coffee enemas, colon hydro, or rectal ozone. As far as weeks 5 and 6, this is the liver and gallbladder stage. So I've provided you some suggestions on how to support your liver with some very liver-focused foods. And then some additional liver support includes liposomal glutathione, liposomal curcumin. Bitters are great because they're going to stimulate bile secretion from your liver. So remember, again, bile is one of the main ways your liver is actually going to get rid of toxins into your small intestine and out through your stool. So bitters are great for that. You can get that as a tincture, like Swedish bitters. You can also do bitter foods. And then here are some suggestions for some herbs that are helpful for supporting your liver and gallbladder as well. Weeks 7 and 8, we focus more on kidney detox. So we're detoxing through our urine here. So this is why it's helpful to use diuretics like celery, lemons, parsley. It's also helpful to drink a lot of water during this time. And then I'm giving you some suggestions for some nutrients like R-lipoic acid, and also some kidney-loving plants that are helpful for kidney function during this time as well. And once you're done with that, kind of week 9 and on is kind of more the maintain stage. So depending on how you feel, I really hope at this point in time, you've learned or felt better, and you've also learned maybe what foods irritate you, what's the best way for you to detox, what's the best way for you to get sweating on a daily basis and exercise, that I hope you are empowered, that you can modify things as you go and do regular detox on a daily basis, on a monthly basis, as a few times a year, whatever works for you. And then if you need additional guidance, please seek a licensed medical provider like myself for more support. Some other helpful detox therapies as you're going through the 8-week detox protocol, or just detox in general, hydrotherapy in the form of hot Epsom salt baths. So we've already talked about how sweating is very crucial for detox. Here's a way to get an additional detox. The magnesium in the Epsom salts helps you get a deeper level of detox. Coffee enemas, colon hydro, lymphatic massage in general, and then other IV therapies like chelation IVs, glutathione, ozone IVs as well. So the special offer that we want to present to you today, I already mentioned, if you buy one sauna treatment, you get one free. But if you do buy a sauna treatment, we will also give you a free glutathione and B12 injection to support detox on a deeper level. And this offer will be valid until March 15th. Here are some additional resources. I pulled some of the stuff from environmentalworkinggroup.org, but also we offer anybody associated with our clinic, or if you're not a patient, to get 10% off supplements through our online dispensary right there. So I'll share this PowerPoint with you later so you could see that. Here is our contact information, our mailing. It's actually our physical address too, not just our mailing, our email, my email address, and our office number. So you can send me an email, you can give us a call, you can stop by our office. We would love to meet you and help you through whatever you need in terms of your healthcare.